think one thing to add is, so you can look at this map and see that there are state privacy laws. They're all going to read differently, but in this box, we're talking about health data laws, children's data laws, wiretap statutes. There's a lot of uncertainty, and let's take children's privacy, for example. Like, what does that mean? There's actually no consensus on what is children's privacy. We all say we want to protect kids, but in some cases, some of the laws, the way the drafts have been written is there may be an over collection of data, which is a danger in itself. Oftentimes it's trying to balance harms to children versus their freedom to develop appropriately on the internet. But what I've noticed a lot is it's very vague. It's, thrust to the states or some regulation. It's a can that's kicked down the road. And it oftentimes puts a burden of similar waiver and consent onto the parents or to the caregivers. And I don't know that parents or even teachers, for example, are meaningfully informed as to what the difference is between a waiver and a consent. So I just want to point, I use children's privacy as like the best example of how we want to have health privacy. We want children to have privacy. We don't have agreement as to what that really means. And so Cynthia was talking about, making sure your data practices are clear. What I would say is, I use this context to kind of underline what Cynthia said. Make sure your data practices are clear, because you will have to have a position one way or another.
So a couple of interesting things to add on that. Maryland is one example of one of the laws coming down the pipe, has a strict prohibition on selling kids info. And so there's also there's these cross sections happening too, where there are children specific laws, we got a couple of them last year, like the Maryland Age Appropriate Design Code, Colorado's amendments to the CPA, Virginia's amendments, etc. But in addition, there's all these specific sections now in these comprehensive laws, like Maryland, around that. Additionally, just to kind of highlight some other state nuances that we're thinking about that are courtesy of some of the folks in Baker McKenzie and our knowledge team, just to think about in Iowa, there's no right to opt out of profiling and targeted ads. So I think, like we saw with Washington My Health, My Data, and some of the other health statutes, I think what Ami's talking about is incredibly important, which is that sometimes you're going to have to take a position, and there's not going to be some holy grail where it's carved into on what that position is. You're going to have to make an informed view on how to handle or execute against some of those things. Similarly, Minnesota is the first state to provide additional consumer rights considering profiling, such as to question the results, be informed of the reasons for the decision, etc. So those are some of the things to certainly look at.